Hello, my name's Dan Muse. I'm an emergency physician at Brockton Hospital and work in the area of concussions as well. I'm also work in substance abuse with the District Attorney Mike Morrissey's office. And today we are upgrading the presentation on concussions to segue into what the governor's new bill has, which is discussing both concussions and substance abuse for our kids in all the towns. I refer to this as saving and preventing brain injuries through from concussions and drugs. Now, first and foremost, what you're looking at is that sports concussions, they are impacting our children in a physical assault on the brain, while chemically we're being assaulted by the substance abuse. Beginning with concussions, what exactly is a concussion? It's a change in how the brain functions, and it's caused generally by a violent shaking of the brain inside the skull. Because of that, quite frankly, you don't actually have to hit your head to have a concussion. As you can see here, it has more to do with how the brain moves back and forth inside the skull, since it doesn't attach to the skull, but in fact floats around. And we call this the coup-counter-coup mechanism, where literally it would be like taking an egg and shaking it. Now, the effects on the brain typically are not going to be seen by an MRI or a CAT scan. In fact, it's at a biochemical level, and I can tell you right now, if a CAT scan is done, if you go to the ER, they're not doing that to diagnose a concussion. They're doing it to make sure it's not anything but a concussion. And because MRIs and CAT scans don't reveal what the concussion is, and because it is a clinical diagnosis, concussions are oftentimes referred to as mild traumatic brain injuries. Now, first and foremost, this has to be one of the biggest oxymoronic statements in medicine, because anyone who has had a concussion knows full well that there is nothing mild about it. How you get a concussion, well, there are several mechanisms. It does occur with a direct impact to the head. And as you can see from all these slides that I'm showing you here, whether it's the ball, the knee, the field where he fell on it, or helmet to helmet, these are pretty common causes for concussions. And right there we see several hockey pitches, including the one that Patrice Bergeron was involved in several years ago. The lower right-hand corner has a picture of him at his first press conference, which was over a week ago. And at that point in time, he could still barely speak. Other ways that it typically can occur is an abrupt deceleration. It's essentially analogous to going 100 miles an hour in your car, you have a seatbelt on, and all of a sudden you hit the brakes hard, and you can feel your body going forward, but obviously it stays in place because you have the seatbelt on. But at the same time, there's a motion forward. So you've gone very fast, and now you're coming to an abrupt stop. And in all these, you can see this happening, where they're getting checked, hit, they're in the air, and in every case, they're moving fast in one direction, and they may not necessarily hit their head, but because of the fast forward motion with an abrupt stop, this is when the brain swishes around inside the skull and slaps back and forth, or rotationally against the skull walls. And one of the things that we should highlight is this myth that concussions have to be associated with a loss of consciousness. In fact, that's really not the case, and the vast majority have no loss of consciousness whatsoever. And even in terms of the symptoms that are most concerning now, loss of consciousness is up there, but it is not the number one concerning symptoms in terms of how long they'll have the concussion. So what is the big concern about getting a concussion in the first place? Let's face it, in my generation, certainly we called that getting your ball rung. You'd obviously never think about not playing in a game just because you got hurt and got hit to the head. And that would be essentially letting your team down. And so it was always considered a minor injury, when in fact it was probably the worst injury anyone could have. And the reason is, the damage is to the most important part of your body, the brain. We are what our brain is. The brain controls everything. It's our personality, it's our abilities to do things. It allows us to do motor skills, calculate information. There is nothing that we do that isn't being done by the brain. So if you injure the brain, you are injuring your abilities to do or be the normal kid that you normally are. And the other issue that we have come up and noticed is that concussions, especially repetitive concussions, are the ones that can potentially lead to permanent incapacitating injuries down the road when the person is older. And like any bodily injury, the brain is the most vulnerable to further injury while it's recovering. So one, we're looking at the brain as the most important part of the body, so obviously you don't want to injure it. Two, repetitive injuries can lead to permanent damage to the brain, which will affect you for the rest of your life. And three, if you have a concussion and you try to play through it and get another one, just like any other part of the body that gets re-injured, that injury is going to be far more extensive, worse, and take longer to heal. Now, who exactly is at risk for the concussions themselves? You can get a concussion in absolutely any sport. I don't care what it is. I have seen concussions in everything, including cheerleading. As I like to say, they can throw, but sometimes they can't catch. And quite frankly, this happens quite often where the base throws the flyer, starts looking around, see if their boyfriend's there to watch, misses the kid coming down, and the kid lands on the floor when they find out their boyfriend's with another girl. So, what are the risk factors? Well, younger is not better when it comes to concussions. There's no question that the kids who are younger have more sustained concussions and it takes them longer to get better. The good news is when they're really small, the physical forces just aren't there that we see a lot of concussions in really young kids. Typically, it starts around middle school and certainly peaks in the high school. And studies have shown, as I said, the younger the athlete, the longer the recovery for the concussion. Gender also plays a big role in concussions. And as you can glean from the pictures, we're talking about females. And indeed, the number of concussions and the duration of recovery for females is greater than male counterparts. The studies that they looked at were, by and large, basketball and soccer at the high school and the college level. And the fact of the matter is, you have tons of kids playing at those two sports. So they had quite the statistical ability to analyze it, and it came out that the girls did have more concussions and it took longer to recover from them. And as I said before, repetitive concussions can lead to long-term disability. For those who don't recognize him because you're too young, Muhammad Ali, one of the greatest boxers of all time, and later in his life he decided to go to what he described as the rope-a-dope, where he just allowed the opponent to pound on him until ultimately they got so tired that now he could go back and finish him off. I'm certain that that had led to his injuries, and for a long time we've always known about pugilistic dementia, which is due to repetitive concussions in boxing. So now what are we dealing with in terms of the signs and symptoms of a concussion? Well, it used to be that we would just worry about, how many fingers do you see? Do you know where you are? What's the score? There's a lot more to it than that. And as I said earlier also, that this is a signs and symptom type thing. It has nothing to do with MRIs and CAT scans. Those are to make sure that you have nothing else but the concussion. It is, as we call, a clinical diagnosis. And the way I break this down for you to remember is we're looking at suspicion, symptoms, and stability. And this will give you the signs and symptoms of the concussion. So suspicion. Did the player take a hit during the game or practice that warrants your concern that they may have a concussion? And you always have to remember that it's not so much that they got a really hard hit, but it could have been that they was hit just right, or it was a decelerating mechanism. And then you have the symptoms. And as you can see from this list, we're looking at a lot more than we used to. And it's broken down into the cognitive or the remembering and thinking symptoms, which, by the way, are absolutely the most important ones because we're talking about student athletes here. And once you get a concussion, sports are done. It's all about the academics. So how the cognitive ones affect you are going to play a great deal into how you do in school. Then you have the physical ones, which we are more inclined to know because of the nausea, vomiting, lights bothering your eyes. These are things that we're pretty much used to when thinking about concussions, and are usually the first ones that the kids will complain of. And emotional lability, irritability, sadness, that all occurs with a concussion. But at the same time, while I'm not downplaying it, the reality is if a kid broke his leg, he'd probably be a little sad and irritable. And sleep disturbance, which is a major issue with concussions, can really wreak havoc when they have a concussion on their sleep. They sleep too much, they sleep too little, it's fragmented sleep. And as I tell parents, the most important healing period is during the nocturnal sleep. By that, I'm talking about when you normally go to bed and get up in the morning, not all the cat naps that you might take because of the concussion. But this is when the body does a heck of a lot of its healing. So controlling that can go a long way in getting the kids healed. And stability. In most cases, you're not going to pick up anything in terms of just looking at the kids. They're going to seem fine when they're just walking around, talking, picking things up. But their fine motor skills, especially their balance, will take a hit with a concussion. So now what about the management of this? Well, fortunately for all of you, Stoughton does a great job. But like anything in life, we can do better. In the initial management, simply put, especially where you don't have trainers at the middle school games, if a coach, a referee, parent, anybody feels that a person got a concussion, just remove them from the play. Whether it's a practice or a game, your first concern should be make sure that they don't go back in there and get hit a second time. And have them rest and avoid any strenuous activities early on. That doesn't mean they have to lie in the basement and they can't get out of bed, and they can do things, but you have to cut it back and make sure that they're getting their rest. And seek medical help. By that, you don't have to rush to the ERs. Well, I am an emergency physician, that's how I make my living. Fact of the matter is, if you come in, chances are you'll be evaluated, examined, and be told that you have a concussion, to take some Motrin and Tylenol, and don't go back and play any sports until you're cleared. And lastly, very unlikely that a CAT scan or an MRI will be done. And get the school involved early. This is key. As I said, the sports will cause the concussions, but once the concussion occurs, sports are off the table. This is all about academics. This is making sure that your children work with the schools, learn what they need to learn, and get the grades that they would have gotten if they didn't have a concussion. But all the rules are changed now. How they go about that, you're going to be very much indebted to the teachers in terms of them working with your child. And lastly, one of the other points which has changed, within reason, if things don't get worse in terms of the symptoms, you can actually go out and do things. We have actually found that recently in studies, the group that gets going sooner actually does better. Now by that, we're not talking about going out and going for a run, playing in the game, absolutely not. But the days of just keeping the kid home for a week and vegetate in the basement are gone. They're allowed to use TVs, they're allowed to use computers, but quite frankly, you're going to have to cut back, and if the symptoms occur, you have to stop doing it. Just listen to your brain. It'll let you know what it can and can't do, and never overdo it. But the group that does get going sooner, that does get back to school sooner, they're the ones who get better quicker. Your brain is meant to do activities, so completely taking it all away in some cases can be detrimental. Now the caveat to all that is, I have seen concussions that are so bad that literally they can do nothing but just lie on the couch. In that case, that's all they're going to do. So management of the concussion itself, well, one, they have to socialize. They still need to be around their friends. So let them do things and hang around their friends so that they do have their social support system. But you have to accommodate the brain. So as I like to say, you can watch a movie in a basement, but don't go to the Randolph Cinema with surround sound because the symptoms are going to get exacerbated. Exercising is fine at low impact, so long as the symptoms don't get worse, which means right away you can do a little stretching, go for a walk, maybe even shoot some hoops in the driveway. But what you don't do is you don't play one-on-one with your older brother who's going to elbow you in the head. In medical management, you want to get evaluated by a knowledgeable person in the management of concussions. One of the things that we now do in this capacity is neurocognitive testing, and the biggest one is the impact test. This is immediate post-concussion assessment and cognitive testing. And it was developed as a sort of a mini neuro exam that allows you to assess how the person is doing with the concussion. It is also very much important that they have a baseline because that allows things to be compared to how they are prior to the concussion and how they are after the concussion. It has been found to be very reliable. It does help manage a concussion, but this is not the panacea. This is not the end-all, be-all. It is in no way like getting a CAT scan to see if the bone is broken. Fact of the matter is this is just one tool. And it does help you sort of gauge how the person is doing and letting other people know, as well as gauge on how much activity they can do. And at the end of the day, it is not a substitute for medical treatment and evaluation. Now, who's going to be getting tested? Well, by law, it is actually middle school and up. This is a group that you want to have tested, and our concussion policies in this state that have been written for legally have concussion management, not just for high school, but middle school and high school. Now, with respect to the classroom, because as I said, this is where it's all about. Sports are off the table. You are not going back until the concussion is healed. But you just can't stop doing the academics, otherwise you're going to fall behind and potentially, which has happened on occasion, have to repeat the grade. So it is about allowing the students to learn and heal at their abilities. You are not going to just be able to go out there and do the work the way you had before. So you're going to have to do it at a slower pace, and you're going to have to figure out what you can and can't do and work with those abilities that you still have or the strengths that you still have. And ultimately, it is not about rushing you back into the game. And school is the most important. The people at the school, the teachers, the guidance counselors, the school nurse. This is a team approach. And all of them have to be involved. And the family has to be very much involved with the teachers, guidance, nursing, so that they can figure out exactly where the player stands or the student athlete stands and work through the concussion and make sure that they continue to learn, but at their pace. So in the classroom itself, you're going to have impairment cognitively and physically. Certain classes could give you headaches. In other classes, you just may not be able to focus because of the complexity of the material. At the end of the day, you're going to find out what you can and can't do, and you're going to try to work at different paces and try different strategies depending on how each class actually affects you. Now, why make accommodations at all for concussed kids? Well, we always focus in sports on sports and concussion. Well, the reality is we're not allowing you to go back and play because if you get hit again, you're going to have an even worse concussion. But we can't take the academics out of the picture. We have to make sure that you continue to go to school and you continue to learn, but at your pace. And quite frankly, the cognitive stress on the brain from the academics is far, far greater than the physical stress that you put on the brain when you have a concussion. So what about the concussions? Well, accommodations should allow the student to continue at their pace. And the accommodations should not exacerbate the symptoms. And that's the fine art of managing a concussion, finding out how much the kids can do and how they can do it. And quite frankly, at the end of the day, while this is a big issue, most kids do really well and they need no or only a few accommodations. And physical symptoms, as I said, do have to be addressed in the classroom as well, i.e. lights bothering your eyes, noise, even headaches. All these have to be taken into account. And as I said also, it may happen in one class but not another. And cognitive planning will entail a comprehensive approach that is different virtually for each class. What most parents who have kids in high school have had a concussion are well aware of is the return to play. Most youth coaches know nothing about this. And a return to play, quite frankly, is the final phase before a kid can go back from the concussion. And the final step in the management is to gradually return them physically to see if the symptoms occur. It's usually 4 phases. You'll do some light stretching the first day, a little aerobics, and then you increase the amount that you do on the second day and add some sports-specific drill. Third day goes full practice, no contact. Fourth, regular practice, and the fifth one, you play the game. And if you get through that without any symptoms, you are now, and not before this, but now you are actually fully cleared from the concussion. If at any point in time the symptoms reoccur, you have to back off and rest. In Massachusetts, it should also be noted that medical personnel cannot clear an athlete for a game or even to go full practice. They have to go through the return to play first. So if your doctor gives you a note and says you can play Saturday and it's Friday, it's not happening. It's not allowed. It's against the law. And even after that happens, because of the return to play, the coaches, the trainers, they have the final say. At the youth level, I've seen it more than once where the coach actually ends up realizing, well, I got a note from the doctor saying it's okay. This kid's still concussed. He can't do half the drills. And you're obliged as the coach to remove the kid from the ice and let the parents know they might want to go back and see their doctor again. And athletes, don't downplay the symptoms of the concussion. Don't ever go back to the game or practice if you think you have one, and seek help immediately. Keep a positive attitude. You didn't let the team down by not playing. As for the parents, trust me, these things are real. We have this battle still going on. Unfortunately, it's not as great, but they're real, and you are their support system. You have to be that support system. Don't make them feel bad about the concussion, and remember, the game can wait. And while it's really hard to believe at times, our kids are our future. So now, we're going to start talking about substance abuse, and in particular, substance abuse in Stoughton. While we are talking about Stoughton, rest assured there is not a town in Massachusetts, or in this country for that matter, that does not have a problem. But in terms of Stoughton, here's what we're looking at. You can see the use of the number of overdoses, the use of Narcan, and unfortunately, the most tragic part is the death. 2014, 7 deaths from overdoses. 2015, 14 people died from overdoses in Stoughton alone. And this gives you a breakdown of admissions to detox facilities, where you have Stoughton on one side, statewide, what's going on as well, in the age groups. Don't be deceived by the ages and think, oh, well, these 18, 23, well, they're out of high school. No, if they're showing up at 18, at 20, they were starting in high school. And in terms of use, this was a study that they did here in Stoughton High and gives you a breakdown of what kids have been experimenting with. This is not that they are addicted to it. This just shows what they've tried. Now, what my interest is, obviously, having been a coach for years, having started lacrosse in Canton, and being an emergency physician, I see it all the time. My great concern is the athletes and drug abuse and how that interacts. And I'm just going to start with this story. True story, 24-year-old male, he came in from a heroin overdose and he asked for a work note. Now, normally they don't ask for work notes, so I bit and I had to know, how did you become an addict? And essentially told me he had played soccer, really good player, had some colleges look at him, and he blew out his knee. And after the operation, he got 90 oxycodone. And then it got affected, so they gave him another 90 oxycodone. And then because it got affected while they tried antibiotics, it didn't work. Well, they had to go in and remove the pin and clean it out. So after that, they gave him another 270 oxycodone he was given, and he was hooked. And I still remember him saying, "Doc, I didn't wake up one morning and decided I wanted to use heroin. It just doesn't work that way." So what's this all about? Why, for athletes and narcotics, why is this such a potential lethal combination? Well, let's think about it. The psyche of the athlete. Okay, the game has always been more important than their health. Just things we say, put me back in, I can play. It's only a bruise, I can suck it up, get through it. I just rung my bell, I'm fine, let me play. And as athletes, you're risk takers. Winning takes extraordinary acts by ordinary people working together. You have to be part of the team, but you are going to do whatever it takes. And if that means taking narcotics so you can blunt the pain and play, guess what? Athletes will do it. And they're emotionally bonded to their team. As they say, no I in team. Team goals are always over the individual goals on the teams that win. And because of that, as I like to say, everybody remembers the names of their coaches, and they'll also remember the records and even scores of certain games, but no one ever remembered the name of their math teacher, or their grades for that matter. And the last thing any athlete ever wants to do is let their team down. And if that means sucking it up, taking some pain pills, by God, they'll do it. Now, what about the narcotics? What does it do? Well, quite frankly, it'll let you play through the pain. It's going to blunt the pain so you can do things. But unfortunately, it also provides a euphoria that emotionally makes things more tolerable. While the kid's lying there with his broken ankle and can't get out of bed because of the surgery, he's taking these pills for the pain, but also for the euphoria it caused, the blunting of the sensorium, allowing him just to sort of put the disappointment away. And because of this euphoria, the narcotics will cause a very much strong emotional and psychological addiction early on. And that emotional craving will quickly change over to a physical craving. So now you have a 17-year-old athlete who identifies himself as an athlete. His confidence, his outlook on life is based on the sports he plays. He wakes up every day motivated to do well, keep his nose clean so he can play the games he loves. And his whole social world evolves around the team and his teammates. And now because he got injured, he may lose all of this. But unfortunately, what no one has been told, the athlete, the family, the friends, or the coaches, is that he's been giving a medication that will treat the pain, but also provide this euphoria that will allow him to blunt the personal disappointment that he's suffering through. And rest assured, they all do. And that this emotional turmoil that the injury caused is going to catamount into a physical addiction. Because why? The athlete doesn't realize that from going from the emotional cravings that they have, you quickly cross over to the physical findings that come up with the addiction as well. And this is where now they're caught on the medications. Early on they took it just to blunt the disappointment. Now they realize that they're having nausea, cramps, feeling sweaty, agitated, all because the body's saying, I need another pill in me. And that, by the way, that addiction can last a lifetime. So how did this all happen? Why is it all of a sudden we're looking at this major epidemic in this country? Well, one of the biggest problems is worldwide, the vast majority of narcotics are prescribed in the U.S. 75 to 80% of all narcotics are prescribed in the U.S. The rest of the world, we left 20% for them. And because of that, in part, the medical community has unwittingly been fueling this addiction. So, prescription drugs. Doctors, we can no longer, there's reasons for this, but some of the reasons that have occurred is that, in part, doctors can't monitor the patients like they used to. You can't keep them in the hospital that long to see how much pain medications they need, so they get large amounts. And the patient and the general public feel that if the medication is prescribed, it has to be safe. Why would they give it to me otherwise? Also, healthcare professionals are now being graded on how well they manage pain. So that is going to affect the amount of money that the hospital and the doctor gets from the insurance companies, all based on patient satisfaction. Unfortunately, though, we've seen this coming, and the sad reality is, even though that we have been aware of this for several years, we haven't seen much of a change by the physicians in all the communities in this country. So, if the doctors aren't going to do it, then the patients and the parents are going to have to. So one of the things that you have to do is take the approach that you are going to emancipate yourself, quite frankly, from what the doctors are doing. And what you want to do, first and foremost, is make sure that you talk to the doctor about the safest way to manage the pain. And you want to control all the medications. I can't emphasize this enough. Don't leave the pills around. Not only do you want to make sure that you know where the pills are and have them locked up, you want to know how many pills are in there at all times. And make sure that you're watching your kids when they take these medications. Never share the medications, which is unfortunately a very common practice, and keep them in the original container so that you know what you're actually dealing with. Not only do you store them in a safe place, you store them in a locked place. Lastly, dispose of them properly. And with respect to pain medications, interestingly enough, ibuprofen does just as well, if not better, than narcotics. And over here, Tylenol is, quite frankly, just as effective. So one of the things is to re-emphasize, don't ever accept a prescription until you've been told all the side effects and all the questions have been answered. And know how many pills have been taken, and keep addictive medications locked up. Keep up with only with what you need, and dispose of the rest. And in Stoughton, there is a kiosk at the police station where you can dispose of the medications. And remember, this is really a very important point. Early on, it's going to be the emotional craving for the medication, but that early emotional craving is going to turn into the addiction. And as I like to say with respect to pain, if all else fails, suck it up, pain hurts, but addiction lasts a lifetime. So what happens if this all occurs to you? What happens if you suspect that your child might be developing an addiction? What are you looking for? Well, you want to investigate what's happening. And substance abuse leads to behavioral changes. They get tired, edgy, labile. They'll change their sleep patterns. They get very disinterested in things that they used to really like. They may just stop doing altogether. What about what's happened to them? Do they have new friends? Are their grades slipping? You have a really smart kid, now they're getting C's, don't care. And these kids that you've never seen before are showing up at the house, and their best friends for the last 10, 15 years you can't find any place. And are they becoming secretive? Always going into their room. Are they stealing? Are you missing money? Jewelry? Becoming deceitful? Always catching them in lies. What about these new friends? You might want to talk to the old friends because they're not going to be willing to come and tell you what's happening. But if you approach them, they'll probably spill their guts and let you know what's up. And you certainly want to talk to the teachers and coaches and find out what's happening. Listen to what they're saying. No one wants to hear that the kid has a problem. But the longer they go with this problem, if they have one, the harder it will be to get them help. And I can assure you, it is a rare person who can actually do really well in school and have a substance abuse addiction. Also, virtually everything that they're doing is probably in their bedroom. So are they spending more time in there? Are they not also wanting to tell you where they're going? Or are they staying out late and coming up with lame excuses? The big one, are you catching them in lies? You get a kid who always let you know exactly what's happening, and now they're just lying to you right and left. And as I said, drugs aren't free, so they're stealing. They have to pay for it. And who are they going to take from? You. Where are they going to start stealing? At home. And go creeping. Social media will have a ton of information. And check their texts. Last time I looked, most parents are paying for the phone, so quite frankly, you own it, you can look at it. And as I said, most of the things that they do is hidden in the bedroom. Go start looking. And if you find some pills in the room, every pill that is legally prescribed has a number on it. So one of two things can happen. You're going to find some pills with a number on them. And you can go to places like drugs.com and plug in the number, and it'll tell you what it is. And you might find out, unfortunately, that it's something they shouldn't have. Or you're going to see pills which will have happy smiles or flowers or things like that on it. That's probably ecstasy. And if it does occur, you got to start fighting back, and you better fight back quick, okay? And if it does occur, I can assure you, you are in the fight of your life. Don't ever play down the symptoms. Don't try to think, well, you know, it's just his age. It could be, but you better darn well be sure that's the case. And never, never, never underestimate your own parental intuition. You know your kids better than anyone. And it could be the coaches, teachers, families. Your instincts about that kid are probably going to be correct. And if something is wrong and you feel it, you're probably right. So in the end, we have two things going on in our schools that we need to address. We need to address quickly, and we have to do a better job in both areas. One is the physical assault on the brain with concussions. And I am happy to say that Stoughton does it as well as virtually any town that I work with. But the other one where we are lagging far behind is with narcotics. And I implore every parent out there to refuse any more than maybe 1 or 2 days worth of narcotics for their child if they ever have a significant injury or surgery. I cannot tell you the heart-wrenching stories that are told to me over and over by young people who have lost their lives, and it all occurred because they were playing a sport. And now their lives are ruined, they're addicted to narcotics, and they're probably going to die an addict. So it is something that we have to stop, and if the medical community won't, then it's time for the parents to take control of the situation and just refuse the medications and force healthcare practitioners to do their job and explain to you exactly what we're doing with the medications and how you can manage pain without narcotics. Thank you very much.